If I had two children and there was the possibility of mutations, I would want to know at the earliest possible stage for their future. The international guidelines that nothing will happen before the age of 10 and that you don't need to do it before the age of 10, therefore, are reasonable guidelines. They're safe. It's safe to wait till 10. But if it's going to do your head in for 6 years, then I think that has to be a part of the reason for screening. So that you know now, but you can be reassured that nothing will happen before the age of 10 in terms of these tumours developing. But I think I would still want it done now so I'd know.
This is a very difficult area, testing children for genetic syndromes, especially cancer genetic syndromes. I suppose the crux of the issue really is, if it's a positive result and the little boy or girl is 7 or 8, what do you do with the positive result? Is there screening that works? Well, the answer is no. There's no, like breast cancer screening, you can do mammography. The Cancer Control Program support breast cancer screening and the other screenings that were mentioned, because they work. But in a young child with an SDHB mutation, what do you do with the result? That's the key thing. Do you do urine tests every 6 months, every year, scans, the fancy scans we're talking about? I think that's the hesitancy of the genetics people to test before 10. But I have to say, I agree with Donald that personally, I would like to know. But again, a personal opinion is not good enough. You need to have a national strategy. But I think the world is struggling with this, with these unusual mutations. Nobody knows exactly what to do or when to test in terms of surveillance.